Hi, so today I'm going to talk about canine pancreatitis and dietary management of it. If you have a cat with pancreatitis, it's actually very different and it's managed very differently. So this video is only about dogs for the moment. So pancreatitis is inflammation of the pancreas, and the pancreas is a really important organ. It has lots of different roles, but the main two or the most important roles are that it secretes digestive enzymes to help with digestion and breakdown of food, and it produces hormones that help regulate blood sugar levels. So that would be things like insulin and glucagon. So when the pancreas is inflamed, it's actually very, very painful. And it can actually be a fatal condition. So getting your dog to the vet as quickly as possible is actually really, really important in these cases. Now, there are a couple of types of pancreatitis with different causes. And there is acute pancreatitis that often comes on quite quickly, and it's usually a result of something that the dog has ingested. So for example, they've ingested a toxin, or they've been raiding rubbish bins and eaten something they shouldn't. Occasionally it would be also a reaction to a medication or a drug as well. Now with these acute cases, often once the dog is feeling better, it's been treated at the vets, usually these dogs can go back onto their normal dog food, the food that they were fed on before, because it was something external that triggered off the inflammation. However, there is also chronic pancreatitis, which is a longer term condition. And there are, again, multiple causes of this. Sometimes it's a result of them having a concurrent disease, so they have another disease condition, and that makes them more susceptible to pancreatitis. An example of this would actually be obesity. Dogs that are obese are much more likely to get pancreatitis or to suffer from it, unfortunately. But with these chronic longer term cases, usually your vet will suggest feeding a low fat diet to try and manage the condition. Now, the reason for a low fat diet is that when a dog eats fat, it stimulates a hormone, CCK or cholecystokinin, and that hormone is what then helps sort of trigger off the secretion of the digestive enzymes. So if the digestive enzymes are attacking the pancreas itself, if you've got a high fat diet, then you want to try and reduce that CCK being triggered. So a low fat diet, what exactly do we mean by low fat? Because there are lots of options out there and it can be quite confusing. So the issue is that there is no general or definitive term that's been decided for what exactly is low fat. So in most cases, all you would need to do is feed a diet that's lower in fat than the one that your dog was on before it was diagnosed. So for example, if you usually feed a diet that contains 15% fat and your dog's had pancreatitis, it's suffering from chronic pancreatitis, and your vet has suggested a low fat diet, you just want to look for something that is lower than what you were feeding, so lower than 15%. However, if you want to be on the safe side and go for a really low fat diet, I would actually advise, as a general guide, for a dry food to look at something that's 10% fat or lower. And the fat level will be labelled under the analytical constituents on the pack of food, and it will say crude fat and then a percentage of fat, and that's what you're looking for. For wet food or raw food, it's slightly different because it's measured differently due to the water content. So you're probably looking more like 4% fat or under. Now, this is a very rough guideline for both dry and wet food because it also depends on the digestibility of the food, as I mentioned, the moisture content of the food and other things. This is just a very crude example of what maybe would be a good starting point for you. There is some consensus on what constitutes a high fat diet though, so something that you could look at to avoid. And a high fat diet is classed as a diet that has 35% or more of the calories in the diet come from fat. So it sounds a bit complicated. So if I break it down a little bit, calories come from protein, fat and carbohydrate. And when you add the calories from those three together, you get the total amount of calories in the food. Now, if 35% or more of the total calories come from fat, that would be considered a high fat diet. Now, it is actually quite easy to calculate this, although it sounds complicated, but your vet or vet nurse should be able to calculate it for you if you wanted to check. Or if you look on the back of the packet, tin, bag, whatever, there should be a helpline or an email address. There should always be contact details for the manufacturer, and they will have people at the end of the phone or email that will be able to answer that for you. So that's another guide to look at what to help you with fat levels. So that's the main consideration when it comes to pancreatitis, but there are some other considerations. You also want to avoid very high protein diets, and that's because protein also stimulates the hormone CCK into helping start that secretion of digestive enzymes. So very high protein you want to avoid as well. Ideally, you don't want a diet that's really, really high fibre, because that reduces the digestibility of the food, and you need a very digestible diet with this type of condition. Now, this is where you might struggle when you're looking at light diets or low-fat diets. Often they are produced for overweight dogs, and low-fat diets are sometimes higher in fibre as well, because fibre is very good at helping to satisfy you if you're feeling hungry. So low-fat diets are sometimes high in fibre, so just check the packet or check with the manufacturer that it's not too high in fibre as well. And then digestibility, this is a really difficult one, but there are a couple of ways to really check. So the gold standard for digestibility is to look at how much your dog is pooing, because if they are going to the toilet loads or producing a lot of poo, then the food is not very digestible because it's going in one end and coming out the other. But obviously that doesn't help you if you've not already started feeding it. So there are a couple of other ways just to give you a rough guide on digestibility. The first is the recommended feeding amounts. Generally, a very digestible food will have lower feeding amounts than a poorly digestible food. So daily feeding amounts are a good guide. The general cost of the food gives you a little bit of a guideline. So mid-range to higher costing food generally will use better ingredients, which in theory should be a little bit more digestible, but that's not always the case. But you don't have to go really, really expensive, but just bear in mind that the really, really cheap foods, they might not be as easily digested. So that's another way of looking at it. So those are a couple of guidelines for you. And the key is just to, as I said, look for a food that is lower in fat than what you've been feeding. Try and feed little and often. Some dogs do better on that because it means that the pancreas, rather than having to deal with one or two large meals, it's actually dealing with smaller, more frequent meals. So that's another thing that you can try. But I hope this has been of interest, and I hope it's been helpful. Thank you.